Welcome, my friends, to the Bob and Brad podcast. My name is Mike Keenitz, and today I am interviewing Dr. Avi Bhar, who is a board-certified sleep medicine and pulmonary disease specialist, and we are talking about sleep apnea today, common causes and common solutions to fixing this problem. If you want to find out more information about him, you can go to his website, which is sleep.com. It is spelled SLIIIP.com. So without further ado, here is Dr. Avi Bhar. Welcome to the podcast, Dr. Avi Bhar. Thank you for joining us today.
Thank you for having me on, Mike.
So today we're going to be talking about sleep apnea, but as you told me, you work with many other sleep conditions as well. So to begin, would you mind giving us a little bit of your backstory?
Well, yeah, thank you. First of all, I'm a sleep and pulmonary physician, and I'm a founder and a practicing physician within our virtual sleep practice. It's spelled SLIIIP, but pronounced sleep. And we see patients in several states. We are present in about 10 states and growing right now. We see patients right from the initial consultation, follow-up visits. We arrange for the home sleep tests. If they need an in-lab study, we will find them an accredited sleep lab that's closest to their homes. And if they need any sort of treatments, whether it's C-PAP, whether it's oral appliance, and I'll show you what an oral appliance kind of looks like, just so you have an idea. This is what's fitted by sleep-certified dentists to ensure that patients actually get their sleep apnea treated as well. So that's what an oral appliance looks like. We will also find a sleep-certified dentist closest to the patient's home whenever we need that, whenever they need that. And we follow them up to make sure that if that's solved, what are the sleep issues they may have, but to completion. And we have annual visits for patients as well. So we act as their virtual sleep practice.
Sure. Do you guys work with insurances, or how does that work?
Yes, we primarily, over 95% of our patients are through their medical insurance, whether it is commercial, Medicare, TRICARE. We don't currently accept Medicaid because of Medicaid's differing rules about how they view HSTs, whether they allow for it. And also their coverage for telemedicine is kind of finicky in different states. So we've just stayed away from that. But we do offer what I would consider a pretty affordable cash price for patients who just want to pay out of pocket for the consultation. And we'll do a digital sleep study as well, anything to bring down the cost of care for them. Because we want to ensure that we don't just act as a sleep practice for people who have insurance, but also if you don't and you need care, we're willing to offer that.
And it looks like your website, if people are having trouble or not good with the internet, there is a call us button right there in case you'd rather talk to someone as well.
Exactly.
So we're going to get in our first subject here, which is sleep apnea. So what is it and what causes it?
Good question. So sleep apnea, really, before even understanding sleep apnea, we have to understand what we consider the canary in the coal mine, which is the snoring that occurs. And when I say snoring, it doesn't have to be the prototypical loud freight train type snoring. It can be any sort of breathing sounds that we make. So what the actual snoring or breathing sounds basically tell us immediately is that there's a narrowing in our airway. Because you notice you and I right now don't snore well while we're breathing. That's because our airway stays wide open. So air goes in and out silently. It's only when we drift off to sleep and everything, our muscles in our body relax, that's when the airway narrows, and then the air having to squeeze through from here to get to about here. Your windpipe has cartilage, so it stays open, but from here to here, it's all soft tissue. And when air has to squeeze through such a narrowed passageway, it causes that vibration of tissue. So whether it is the heavy breathing or a snoring, it is all basically indicating that there's a narrowing in our airway. So that's what snoring represents, or heavy breathing, or any breathing sounds while we're trying to take a deep breath. Think of sleep apnea as the worst form, not necessarily the loudest form, but the worst form of snoring, where your airway is not only narrowed, but can also sometimes come to a near complete close. What this does to you is that instead of allowing you to get into this good, deep dream sleep and waking up all bright-eyed and bushy-tailed, you kind of sometimes feel like your sleep may be broken up. And so even though you may get 8 hours of sleep based on your watch, your clock, you actually never feel like you got that many hours of sleep. You don't wake up refreshed. It's like you charge your phone and you put your phone in the charger and you come back the next morning, it's half charged. That's how you feel. It's funny because most people, if they see that with their phone, the first thing they do is they're going to go to their Verizon store or whatever stores they go and just say, hey, I need to change my phone. I need to fix this. But as human beings, when it comes to our own body, we tend to adapt and we use caffeine or routines to kind of help us get up, or we keep snoozing in. So when we don't feel we're waking up refreshed, we have to understand why. And so what happens is that when that airway of yours narrows, and this can happen multiple times an hour, when it narrows, the only thing that's going to restore muscle tone and open up that airway is the awakening of the brain. Because the deeper sleep your brain is in, the more relaxed your muscles are in your body. Same with your airway muscles. So here you are trying to get into deep sleep. It goes, uh-oh, Mike, get out of there. So it lightens your sleep up. And then again, you try to get into deep sleep, your airway narrows, kicks you back up again. So this is what caused that fragmentation or the disruption of your sleep, not allowing you to get into the deep, refreshing, deep sleep or REM sleep. And that's why you wake up unrefreshed. So that's what snoring represents. That's what sleep apnea is, and why it affects the way you feel, or how you feel when you wake up, or how you feel when you sleep. So that kind of covers that.
So you mentioned some of the symptoms in that explanation, but are there other symptoms of sleep apnea?
So sleep apnea disrupts your sleep. So that itself opens up a whole lot of symptoms. And again, how we perceive our sleep or symptoms is very much a personal experience. And our usage of words tends to be within our own limited experience. So when we have disruption in sleep, a lot of times we assume that to be insomnia, because insomnia covers I can't sleep, I can't stay asleep, I wake up tired. But what's driving that insomnia? Is that insomnia just is that a diagnosis once you've ruled everything else out, or is that just a symptom? And so not sleeping well or not waking up refreshed is the first sign of poor sleep, or there's something wrong. Now, if you do have loud snoring, or if someone has seen you kind of gasp for air, or someone's seen you kind of feel like they hear you stop breathing, like you snore, they hear you breathe, and there's a real quiet pause, and then they kind of hear you breathe again, those are kind of the more, or the prototypical, the more common symptoms that we associate with sleep apnea. But there's a lot of other symptoms that we find, whether how we perceive about sleep, like, waking up a lot, waking up to use the restroom at night. That's also another sign of sleep apnea. So urinating at night frequently, because that goes against the body's natural mechanism to actually reduce urine output so that you can actually sleep through the night uninterrupted. So if you're breaking through that and still waking up to use the restroom, a lot of patients go down the pathway of getting their prostate checked out, or for women to see whether they have bladder issues, because maybe pregnancy and there may be some stretching of the pelvic muscles, and people assume that, but in actual fact it could be driven by your sleep apnea. How you feel during the day, whether it's mood wise, whether you're feeling down and low energy, whether you feel more anxious, whether you feel like you're always tired or fatigued. Chronic pain is another one as well, because the interaction between pain and sleep, where sleep actually feeds into the pain. The poor sleep that you have causes your pain perception to change, and for experienced patients to have more pain. So if you feel like you're fatigued or chronic pain issues, not sleeping well, if you have nocturia, where I talked about, where you wake up to urinate at night, obviously the prototypical symptoms that I described earlier, a lot of this can be signs and symptoms. Waking up with a headache, waking up grinding as well. The headache it goes along with the fact that when your sleep is also fragmented and your brain keeps getting disrupted, the headache is really because your brain has been on standby mode for most of the night while you were asleep. So while you thought you were asleep, your brain has never really achieved that deep sleep. So there's a lot of these symptoms that and that's why it's so difficult for a lot of patients to understand that they may actually have sleep apnea, not just insomnia, because how it affects us is very much a unique experience for us, and it may not be the vocabulary that we're comfortable using. So if you go to your provider and you say, oh, I have difficulty sleeping, I have insomnia, there's a knee-jerk reaction to give you a sleeping pill. But have we missed out on a potential issue that we're not even addressing right now? If you go to your provider and you say, oh, I'm feeling fatigued, they're going to check your B12 level. They're going to check a TSH level. If you're a male, they may check your testosterone level. If you say, I'm not feeling great, I'm not feeling manly, I can't seem to, have an erection. All of these things kind of take us down different sort of pathways, and we go down the wrong rabbit hole. It leads to a lot of blood work, a lot of testing, a lot of treatment. You might feel slightly better, but we always miss the mark on that, and if we don't address the sleep issues.
That's very fascinating. I never heard that if you wake up to go to the bathroom, you could have sleep apnea. Is that pretty common?
It is actually. It is. Not everyone. Again, this the same thing with like side effects of medications. Not everyone has it, but a lot of people do. And they usually put it down to, oh, I'm getting older, this is what I expect because this is what my dad had, this is what my friend has. And so we expect that, we expect to wake up tired, or we expect to wake up unrefreshed because, hey, I'm getting older, this aches and pains are par for the course, or I'm going through menopause. And what's interesting with menopause is most women that go through menopause have the hot flashes and so on that may disrupt their sleep. But this kind of goes away and their sleep persistently is an issue. And what we find is that while men tend to come to our attention, as in the healthcare field, a lot earlier to complain about their sleep apnea issues, because usually men are like peacocks. They're loud snorers. They get picked up easily. Their spouses, force them to seek help. But we ignore a lot of women because, firstly, women don't snore as loudly. Some of them don't hardly ever snore. They just might have some heavy breathing. The partners may describe it as puffing or huffing in their sleep. And so not prototypical signs of sleep apnea. And then on top of it, we find women present a little bit later in life because once they go through menopause and they lose that estrogen, and estrogen protects the strength of their muscles, not only the big muscles, but also airway muscles. So a lot of women tend to have a spike in their sleep apnea. Actually, their risk goes up nearly 3 times through menopause, and they continue to have sleep issues, and then they get put on antidepressants because they have low mood. They get put on anti-anxiety medications because of the sleep disruption causes a lot of anxiety building stresses. Because every time that I talked about whether your brain is awoken because of the narrowing in your airway, it's not a gentle nudge. It's not like, hey, Mike, wake up, please. It's a jolt because you were essentially suffocating. And so the body or the brain sends down what we call the sympathetic drive or the stress response. And imagine that getting flushed into your system multiple times an hour throughout the night while you're asleep. And that, you should have your system stimulated during the day and then decompressing at night. But with sleep apnea, you have your stress levels high up and throughout the day and night. So you don't get a time to decompress, and your body's now tired and fatigued. But at the same time, you're pumped up with all these stress hormones or stress responses that a lot of people have this sort of balance between, oh, I'm feeling anxious, but I'm also feeling depressed. And I find, what I call this common medical baggage. I'll see patients with thyroid issues. I'll see patients with depression issues. I'll see patients with anxiety issues. I'll see men on testosterone shots when they come in and they put in their medication list. And immediately I already have a sneaky feeling that they have sleep apnea as an issue. Because the question really that comes in my head is, why is Mike the unluckiest person in the world? Why is he suddenly have all these issues? And what's going on? I mean, don't get me wrong. Some people do get issues and they get multiple medical problems. But if we see, a common thing that a lot of patients mention, especially women, especially when they go through menopause, is like, I feel like my body's breaking down. I feel like everything is going wrong. And actually that is driven by their sleep issues, because everyone is addressing some of their symptoms. I feel fatigued. Okay, do this. Go check the cardiologist. Oh, I'm feeling this way. Go down, go get that blood work done. Go get this shot. Try this supplement. But no one really stops and asks, are you sleeping well? Are you waking up refreshed? Because a lot of providers nowadays are not well trained in understanding sleep or addressing sleep. And there's not as many sleep physicians around as well. The US produces about 150 sleep doctors a year. And if you look at the obesity rates and you look at sleep apnea rates, you look at insomnia and so on, it's such a large number of patients out there that don't get enough care. So the providers the primary care doctors may be left to deal with that. And unfortunately, they have a limited amount of time to kind of discuss the issues and kind of work through it, and let alone as well understand how to address it.
Sure. So a common phrase I always hear my mother always said was, "I'm a light sleeper." Is that I quote, I kind of say that too because I do wake up frequently, but I fall back asleep. Is that like a sign of sleep apnea too, or is that something different?
Well, so the light sleeper is another thing. It's a red flag. Immediately I hear that, I've got a smirk in my head and I know what's going on, because we have to understand, if you don't sleep or don't sleep well, the question is why. It's just like, oh, I don't feel thirsty, or I don't feel hunger, I don't have a sex drive. These are all very natural urges that we have, very natural systems that are in place to protect us and our health. And if they're not working well, we need to figure out why. So when you say you're a light sleeper, and the thing is this, we always come up with stories to justify how we feel, or we come up with explanations so that we can say, oh, that's why it is. And I have a lot of patients say they're light sleeper, And women will say this, and I've heard this so many times, where I'm a light sleeper, but I developed it after childbirth because, I had to keep waking up a lot for my child, and I had kids growing up and they were sickly. So I've kept up that habit. In actual fact, they may have gained some weight after childbirth and the sleep apnea really came to the fore and they never lost that weight. That could be one explanation. But going back to your point, the light sleeper is kind of what I talked about. You should be getting to the deep valley of sleep. You should go through that REM cycle, which happens every hour and a half, where you go through light sleep, deep sleep, REM sleep, and that should repeat. But if you stay in the light areas and you always feel like you can hear things, or you get woken easily, or you get startled easily, any sort of sound, you're such a sensitive sleeper, we need to find out, why aren't you getting to the deep sleep? What's stopping you? Now, could that be a medication issue? You may be on another medication and may be disrupting your sleep. Could it be another underlying issue, like are you depressed, and maybe that's causing you some issues? But in actual fact, a lot of times it's a sleep issue and we're not addressing it because a lot of people don't know how to address it.
Sure. Yeah, I guess mine doesn't bother me because I don't feel like I need more sleep when I wake up. I feel fine. I don't know.
So
I just thought it was just the way I am.
interesting thing as well, because you see, the thing with sleep is that, unlike where you get short of breath, or unlike pain, unlike anything that affects us immediately, we know what it was like yesterday, and now we're like, man, that's a big difference. I need to seek help. But sleep is something that creeps up on us over months to years. You don't just develop sleep apnea overnight. It takes months or years to start building and then becoming more and more apparent. Now, when you're younger, just like I explain to patients, maybe it's probably not the best thing for a doctor to say this, but when you're younger and you drink maybe a few extra drink or alcoholic drinks, you can kind of brush off the hangover the next day pretty quickly. But as you get older, man, that kicks you in the butt. And the whole thing with sleep as well, you can sustain poor sleep initially, but as you get older, that's going to catch up on you, and you're going to start feeling like your body's breaking down as well. And the thing that I talked about, that time lag, is that our expectation of sleep, because it happens so gradually, also changes our expectation of what we should feel like when we get up. I'll give you an experience recently that really, I think, was insightful for me. I was recently diagnosed with sleep apnea. Um, and it came about because my wife mentioned that I snort sometimes and so on. And I really was looking back, because I do this every day. And I was like, all right, am I feeling the same? When I noticed that I haven't been, I used to, about a year ago, I used to jump out of bed and ready to go. I could work out and this, but I've been making excuses. I've been snoozing in a little bit more, and I've been blaming it on work stress. But in actual fact, it was my sleep apnea. And it's only because I'm so attuned to kind of being, is this sleep apnea? Am I the same person that I was 6 months ago when I wake up, and I could tell the difference? So I started therapy, and it's much, much, much better now. So yeah, that kind of gives you an idea. Sometimes our expectations of what we should feel like, really, that's what delays seeking care as well.
Sure. So you talked a little bit about snoring before, but you have to snore to have sleep apnea?
No, not really at all. Another funny story, and this is more of an embarrassing story. I've been married to the same woman for 11 years. She's a physician. She does not snore, and I failed to diagnose her with sleep apnea. And because she does not snore, and again, am I listening to her at all hours of the night? No, I'm not. So whenever you ask your spouse or your partner, bed partner, do I snore? It's like, do I snore the first few minutes when you're listening to me, and the last few minutes before I wake up? And that's the only time we actually listen to it. So are we actually hearing them breathe throughout the night? The answer is no, because our muscles in our body, the muscles in our airway, get more and more relaxed as the deeper sleep you're in, which tends to happen later on in night. At night, you get more REM sleep as the further in the night it goes into. And so we tend to either, like I said, women tend to heavy breathe, they puff. Men may snore, sometimes hardly. I get this, I only snore when I'm really tired. Yeah, but that's because you probably were snoring and really slightly. But when you're really tired, you kind of go through different sleep cycles a little bit, and that changes which sort of stages you're in, and that may cause you to snore a little earlier in the night. And that's when your partner may pick up on that and say, oh yeah, you only snore when you're tired, so that shouldn't be a problem. Actually, that's not the case, because the snoring already, or any breathing sounds, already indicates that there's a narrowing in the airway. And if you're feeling you're not sleeping well, whether it's falling asleep, staying asleep, or even waking up unrefreshed, then you might have a sleep issue and need evaluation.
So this is a little off subject, but if people I know when they drink they snore, is that because they're getting into a deeper sleep or?
So there's various reasons why. It's a different kind of sleep that they go into, but there's also a lot of fluid buildup in their system because the excess fluid that they take in. So sometimes our soft tissue, our airway, gets a little bit more engorged and more likely to be collapsible. So there's various reasons why alcohol may make us snore, but we do make sure, a lot of times patients will have their sleep apnea issues predominantly where they drink, and they don't have as much issues when they don't drink, and that's because the sleep apnea does worsen with alcohol because of how it relaxes your muscles and so on, and how it kind of may engorge your airways as well to kind of be a lot more narrow. So there's various reasons why. So we will usually, if a patient is a a 2 glass of wine drinker at night, when we do the sleep test, we'll tell the patient, you do what you normally do. If you have 1 or 2 glasses of wine, we want to see that normal state because we don't want to test you in an artificial state that you don't normally live in. And I'm not trying to propose that you drink every night, but if that's what you do and that's part of your usual routine, I want to make sure we see that, because otherwise we may miss the diagnosis.
Sure. Ah, interesting. Makes sense. So we're gonna get into how sleep apnea is diagnosed and what are the different types.
Okay, so I'll start off with the types. The two types of sleep apnea, one is called obstructive and the other one's central. Obstructive sleep apnea is by far the most common, and it is the one that I talked about where the airway narrows. And that's what kind of stops your breathing from occurring. So you don't actually get to move air in and out. But central sleep apnea is when your airway seems to be somewhat open, but your brain doesn't trigger the breath as effectively as it should. And there's various reasons for this. You could be on heavy sedating medications like opioids and heavy benzodiazepines like lorazepam and so on. These medications really then may reduce your respiratory drive, causing your brain to kind of be sluggish and not prompt the next breath to occur. Then there's also health issues that may cause that. You may have a stroke in certain parts of the brain that may not trigger the breath as well. So that's when central apneas may be more prominent. Apart from medications and strokes, you can also get it if you have heart failure. In very bad heart failure, because of how the blood circulates and the oxygen levels and the carbon dioxide levels doesn't give feedback as quickly because of sluggish blood flow, the brain doesn't get feedback about the control of the oxygen and carbon dioxide. So it tends to overshoot or undershoot, and that causes us to kind of stop our breathing and then have huffing and puffing and then stop our breathing again. So that central apneas can exist as well in patients with that. But just having central apneas in your sleep study results doesn't mean you have central sleep apnea. We all have some component of central events that may occur. We have that a lot more when we're younger as kids. But as you get older, you may still have a small number, but that's by far not the most common reason. So for you to have central sleep apneas, you need to have most of your events, over 50% of them being central. And the treatment options available at that point are very different. The testing for central sleep apnea, you asked about testing, will likely have to take place in a sleep lab itself to make sure that they're capturing everything that's going on and making sure they can tell the difference between obstructive and centrals. Because home sleep tests, which are generally done for a lot of our obstructive sleep apnea patients, now, the newer home sleep tests do a very good job of picking up between central and obstructive. However, the older type devices weren't as good at picking up the difference. So the home sleep test comes in various forms. We do two different kinds of sleep tests. One is actually a ring-based test that actually just sits on your ring finger, and it just records. It syncs with an app that you download, and what it's meant to do is actually recording characteristics of your blood vessels which are connected to your heart. And so your heart responds in different ways based on breathing events that occur. Because of how you breathe and how your chest wall interacts with your heart and so on, there's sort of these characteristic signals that occur when you're not breathing well. So that's how that device figures out, even without having any sort of things on your face. With that ring, it's able to actually monitor and tell you whether you have sleep apnea. So that's one type of device that we use. And then there's a second type of device that we frequently use that's also the common workhorse among a lot of other sleep practices. It's what we call a device that has three sensors. One looks like an oxygen delivery device that's measuring, but it's actually measuring your airflow. So it's not delivering oxygen, but it kind of looks like it. The second sensor is it's a pulse oximeter, and it measures your heart rate and your oxygen levels. And the third is a chest wall belt that goes around your chest wall to measure your respiratory effort. So he's trying to figure out is if you're trying to take a breath, does it see a drop in your airflow here, which means that you're not moving air, and at the same time it also sees an oxygen level drop. So that's how it picks up on obstructive sleep apnea in general. So those are the two type of devices that are home sleep tests that are very common and frequently used as well.
So do those work for the central type sleep apnea too then?
You can, yes, exactly. So when we see patients with a predominant central apnea on the home sleep test, we will then, following that, send them, depending on how compelling their case is. Because if I see like nearly 50% of cases and this patient has no risk factors, nothing clear as day, I'm going to assume that the machine was probably meaning obstructive apneas and not central apneas, and it misdiagnosed that, and treat them as an obstructive apnea because that's the most common. Because otherwise, if you go down the pathway of assuming that this is central, then you have to send them for an in-lab study, which for some patients can cost anywhere between $700 to $1,000 out of pocket if they haven't met their deductible yet. We're always concerned about making sure we take care of the patients, and we want to make sure that we don't kind of put them through any financial difficulty. Because we don't have a financial interest in getting them to the sleep lab. We're just wanting to do it for clinical reasons. We don't own sleep labs. We don't have contracts to read sleep studies at sleep labs. So whenever we refer a patient, we also have to take into account whether the patient would want to go through it and what benefit it is for us as well. How is it going to affect our treatment? So if they don't have that many centrals, but we're going to assume that they have an obstructive events, and mainly maybe some of them misdiagnosed as centrals. But if they come back and there's a lot of central events and they have all the risk factors for central sleep apnea, like either they've had a history of stroke or they take heavy medications, sedating medications, and so on, that's when we will prompt them to go to a sleep lab, because they may need a different type of C-PAP machine or a breathing machine, or they may not even need one. They may just need oxygen, for example, if that's what they truly have.
I wish I would have talked to you before my girlfriend got a sleep apnea test recently, because her bill was way more expensive than what you mentioned.
Yeah, it's sometimes crazy because, and again, this is not to speak ill of other sleep physicians, but just to kind of be aware of the conflict of interest. When you're a sleep physician in a local area, and there are 2 or 3 sleep labs, you probably read at all sleep labs. What you're probably going to do is try to get your patient in one of the sleep labs, because there is a sort of a dirty secret that you actually get paid 3 times more to read the same sleep study from a sleep lab or a similar study. And don't get me wrong, the in-lab study has a lot more data. It does take longer to review. It does cost more to the patient, but the physician as well gets paid more. So there's usually a conflict of interest there. And we try to stay away from that by managing a lot of this as home sleep tests, and then we send them to a sleep lab, but only when we're clinically needed. But yeah, there is a lot of conflict of interest in healthcare as well, that doesn't allow for appropriate patient care, whether it's financial or clinical.
Right. Oh, well, too late now for her. Anyway, so our next question are, what are the risks of untreated sleep apnea, and how can you actually treat it?
So the risk for untreated sleep apnea is, we're understanding more about the effect of this in the last 10 years, right from, let's talk about mental health, right from anxiety, depression, bipolar disease. Overall, we see that there is the evidence now that we have a bi-directional model, meaning that sleep feeds into poor mental health and poor mental health feeds into sleep. So, previously we was try to figure out, why don't we treat the depression first, because that should help the sleep, or let's treat the sleep first. But in actual fact, you should try to address both at the same time, because we know that there's a worsening in sleep, in depression, anxiety, and all mental health issues if we don't address the sleep issue. So one thing is worsening, or even, and I talk about mental health, I'm also including attention deficit disorders and so on. And mental health is one that definitely deteriorates when we're not getting good sleep. Number 2 is heart disease as well. Things like what we call atrial fibrillation or heart rhythm issues, that gets triggered or re-triggered if we don't treat our sleep apnea. It can cause you to have pulmonary hypertension, which is pressure within the heart that's due to breathing issues as well. And pulmonary hypertension can be triggered by sleep apnea. Atrial fibrillation can. You can also get angina or chest pain, what they call atypical chest pain. So you wake up with chest discomfort or chest soreness. but a lot of it is stemming from the fact that your body was trying to breathe and your muscles were working hard the night before, but sometimes you can't tell the difference. And if you're slightly overweight or you have diabetes or high blood pressure and you have chest pain, the physician has to take you seriously because you could actually be having a cardiac event. But if the workup usually ends up being negative, it's because you have sleep apnea, something that triggered that chest pain or atypical angina. Some people have reflux. So reflux is another thing that frequently occurs in combination with sleep apnea, because the narrowing of the airway, there's something called the Bernoulli effect. So when you suck on a straw, you'll notice that the middle portion of it collapses. That's because of the drop in the air pressure here causes that narrowing. So same thing, when you're trying to suck air through a straw, which is a narrow passageway from here to here, it creates a negative pressure at the back of your throat, which then drags up your gastric juices and causes reflux. Plus, you're laying flatter than you would be during the day. So now not only is the stomach in a closer plane to your throat, but now you also have this negative pressure generated at the back of your throat that draws up reflux. So you have mental health, you have cardiac issues, you then have issues related to reflux. You can also get worsening of your asthma and your sinus issues, any breathing issues as well, because we find that when patients have breathing issues related to sleep, they have breathing issues and then they have sleep apnea, the repeated collapsibility of the airway throughout the night, whether it's here, or even lower down in your lung, causes an inflammatory reaction. The body is stressed, it's inflamed, it gets more engorged with inflammatory markers. That's what causes a lot of sinus issues, congestion, post-nasal drip. And we find that once we treat these patients and the airway stays open, that it's not constantly collapsing. And it collapses because of the Bernoulli effect as well. You're trying to get air sucked in. The negative pressure is what narrows that airway down even further, and that's repeatedly going on, and that's what causes inflammation. So we find that patients treated, they also have an improvement in the asthma symptoms and their sinus symptoms as well. Headaches as well improve. So you can get worsening headaches. You can wake up with headaches. I've had patients, you talk about your girlfriend paying so much out of pocket, but we have patients who are taken down a rabbit hole of Botox injections, MRIs of the brain, and this supplement, that injectable that causes thousands of dollars for headaches. Did anyone ask them, how are you sleeping? No, because none of them are trained in sleep. And when they got trained, sleep wasn't a prominent field within medicine. So frequently, these patients with headaches as well end up going down the wrong rabbit hole. So that's just kind of giving you a flavor of just some of the issues that patients do have, and what can happen as a health consequence of sleep apnea.
So, what are the treatment options for sleep apnea then?
So treatment options, thankfully, now are a lot more than what they were. Now, I'll talk about the scariest one, which is what everyone seems to hate. It's a CPAP device. And I'll show you what a CPAP mask nowadays looks like. You see this? It's not as scary. It is not the sexiest device. I didn't say sexy, but it is not as big and hulking as we assume that. A lot of us have this Top Gun, Darth Vader lookalike image. But the masks nowadays are a lot better. Plus, the machines nowadays, the CPAP, are pretty much near silent. Like you don't even hear it. So the machines are much more intuitive. They've got automatic algorithms that doesn't matter whether you're on your side or on your back, whether you're in deep REM sleep or whether you're in light sleep, the machine pressure goes up and down based on the algorithm. So an automatic CPAP is what we frequently use, and that's what commonly is used to treat sleep apnea. Now, the next thing is the oral device that I showed you earlier, which is basically trying to keep your lower jaw tethered to your upper jaw. So it's meant, if you notice, when you fall asleep at night, you may slack off your lower jaw, drag your tongue backwards, and narrow your airway further. So the oral device is meant to keep your lower jaw forward. So that's what this device does. Now, different manufacturers have different mechanisms. Some of them have like a screw-like mechanism here, but this one uses a blue band, but it depends on your sleep dentist, what's he best well-trained in and what's he's comfortable with as well. But the idea is you wear this at night when you go to sleep. Now, the oral device works really well if you have mild to moderate sleep apnea. In the severe range, your CPAP is probably your best friend because that's what is validated. But we frequently make exceptions when patients have gone down the road of CPAP, hasn't really tolerated it. We've worked with them. We've tried different masks, different pressure settings, and we're like, all right, let's go down. And even though the oral appliance in severe sleep apnea may not work as well, we don't want perfect to be the enemy of good. And so we want to make sure we treat most of the symptoms if at all possible, especially if someone says that they're willing to use the oral appliance every night and they don't want to use the CPAP more than 50% of the night. What are you trying to do? Just trying to force a round peg into a square hole? And that's not our goal. Our goal is to make sure patients are sleeping better. So we'll figure out a plan for them based on their needs. So the CPAP is one. We have the oral appliance as a second option. The third one is going to be something that's much harder to achieve, which is weight loss. Now, weight loss does treat a lot of sleep apnea, but a lot of us genetically also have a propensity to have a narrowed airway and develop sleep apnea at some point, so that we don't have the weight to lose. But for those that have the weight to lose, it does have a significant impact on improving your sleep apnea and potentially curing it. So you can achieve that either through bariatric surgery. You can achieve that either to your own efforts as well. The only problem with your own efforts is very few people succeed, because when you have weight and then you have sleep apnea on top of it, it's very hard to get down to your weight issues if you're waking up tired, your body's stressed, you're exhausted, you're just trying to survive the day to get from point A to point B and get into bed again. And then, it's like Groundhog's Day, you wake up tired again. And the way I describe it to patients is, working out and living a healthy life is an active decision that you have to make constantly, because we're getting barraged with everything that's sugar this, quick fix this, deliver this, we'll get it, you can eat this and so on. And supermarket aisles are all filled with a lot of processed sugar and so on. So we have to actively make decisions throughout the day about what we want to put in our mouth, because there's no out exercising a bad diet. But when you wake up tired and exhausted, it's like starting, it's like the 100-meter dash you start off with every day. And everyone is running out of the blocks all excited. But when you're not sleeping well, it's like starting 10 meters behind everyone else. You're just going, hey, everyone just carry on. Mike has got his own pace. Mike will catch up. Just chill. I've got my own thing going on. So when you wake up tired and exhausted, the body does two things to you. One is it doesn't want to exert energy. It doesn't want to burn calories. It's exhausted. It's stressed. Number two, the body also craves more calories. So it's constantly messaging you to say, eat something, put something in your mouth, and so on. And that's what causes issues. And so that's why weight loss, while easy to say, it's harder to do. And frequently, if you have sleep apnea in the mix, it causes a slowness and actually stops you from losing more weight. A lot of now weight loss clinics and even bariatric practices are now having patients screen for sleep apnea because they know the effect sleep has on their weight loss journey as well.
Yeah, and this can happen in different realms, because there's people that gain weight for reasons like, I know pretty much every one of the top 10 strong men in the world competing, even though they're strong, they're so big, almost all of them use CPAP machines just because of that extra weight on them.
Yeah, NFL players as well, because of all their muscle mass and so on. It doesn't allow for much. I mean, sometimes I look at, I do this, so I walk around in the crowd and I see people and I'm like, oh, sleep apnea, sleep apnea. I was like, I want to just tell them, please go get help. You don't have to see me, just get help. There's help out there for you. But there are the treatment options as well. So weight loss is one now. One thing I want to caution against is surgery for quick fix nasal passages, deviated septums, large tonsils. Now, while they may work for kids removing your tonsils, for adults, there's been a lot of these sort of therapies, laser therapy to remove excess tissue, but that kind of dumbs down the dynamic and complex airway that we have. We have airways here now. If let me just put it this, a lot of patients of mine have nasal surgery. They've had, my ENT guy said it was deviated. I did this, did that. It felt better. Oh, but I still snore. So yeah, if this was the only fix that you need for sleep apnea, then guess what the body would do? Open your mouth, bypass the nose, and you cure your sleep apnea. But it doesn't happen that way, because our airway is a lot more dynamic and complex. So it's longer and it stretches all the way down here. Just trying to fix this or fix this or fix this doesn't solve the issue. It may put a Band-Aid on it. You may feel better. You may snore less for a few months or few years, but sleep apnea will come back, because the idea that you can cut and chop and change and so on, and that's how you'll deal with the body, is a little short-sighted, and I don't think it really gives patients the idea, because a lot of patients come back to us going, well, I did well for a few years, and then I was like, yeah, I know, because the data as well supports the fact that there's very little surgical intervention that can help with issues. Now, with children is different. There's a lot more evidence for tonsillectomies, but even we find now that these patients should be followed up because a lot of them continue to have sleep apnea, though their symptoms may not be as dramatic. And then they end up having behavioral issues, learning issues, and so on. And then they get put on ADD medications, and they get put on this and that. And then you're just kind of playing whack-a-mole, but you're not addressing the fact that they're not sleeping well. And no one asks them, are they sleeping well? I think a lot of people don't want to go down or open that Pandora's box because they feel ill-equipped to handle how, what questions may come their way or how to handle it. So weight loss is definitely there. Surgery is definitely something that I would caution against. Now, if you have concurrent issues, like if you're at the same time having a lot of sinus congestion, there's an actual indication for it, ear infections, if you can't swallow properly, ENT surgery, and at the same time, could it help your sleep apnea? Maybe. Then definitely go for that. But surgery for sleep apnea solely is, you're going down the wrong hole on that one. You probably come back to square one in a few years. And the last option as well for treatment is a new device that, I say new, but it's been around for close to 10 years now. It is an implantable device, a hypoglossal nerve stimulator. Basically, what it does is it's kind of like a pacemaker that keeps track of each breath you take. So then it then triggers, it's got a little lead that actually triggers the stimulation of your tongue nerve. So it keeps your tongue contracted and forward. And so that keeps your airway open. And that's used in patients with moderate to severe sleep apnea. Now, granted, a lot of patients are jumping on that because they're like, oh my God, I don't want to deal with a CPAP. Many of them tried CPAP 10 years ago. It's a different beast now. It's like saying what an iPhone looked like 10 years ago compared to now. So a lot of them were put on the wrong masks. They were initially start off with a full face mask, but now we know the full face mask is actually poorly tolerated. I get this statement and it kind of drives me crazy. Oh, I was told I needed a full face mask, which is the one that covers your nose and your mouth, is because I'm a mouth breather. Well, I'm very rarely have I ever come across someone that is a sleep apnea patient that hasn't opened their mouth to breathe, just because when you're not getting enough air through here, your body's going to say, you know what, I don't need humidified air, just give me any air because I'm struggling for breath. And you open your mouth. That's why you frequently may wake up with a dry throat as well, because you're not going through the natural humidification your nasal passages provide you. So, in terms of opening your mouth, you generally do that already. A lot of patients actually adapt back to sleeping with their mouth closed. Once they have a nasal mask on, they tolerate it a lot better. So before jumping to the Inspire device, we always urge patients, give us a chance first. Before you want to cut open your body and put something in there and do all that stuff, let's follow the guidelines. Let's really do what's right by you. Your experience 10 years ago may not reflect what your experience is now. But we do have patients who truly have gone through and need that device, and we've referred patients for them. We will continue to refer patients for them because that option is life-saving for so many of them that for whatever reason, the machine algorithm just doesn't work well for them, or the mask fit just doesn't work no matter how many different masks they find. So that's where the hypoglossal nerve stimulator that's implantable like a pacemaker actually makes a lot of sense.
Yeah, I think I'd rather have a CPAP machine and something put inside me, because how long do those last?
Until the batteries run out, then they can change that out. But again, that takes into account that it works forever, and it doesn't. And leads may break, the leads that they implant may break, and so on. So you might need redos.
Yeah.
It's a fairly new technology, so we don't really know the long-term effects of it. But again, I think I don't want to be someone that is afraid of advancement, because hey, we run a virtual practice, so we have to embrace everything that's new, even though it makes me feel uncomfortable to have to put something implantable in you. But we will get to that in a stepwise manner, because I would want to treat you the way I would treat a family member of mine, because otherwise I can't sleep at night. If I've done something that I've taken cut corners and I've just listened to you because consumer is king, I'm doing you a grave injustice. So I'm always honest with patients, and our practice is, that's what we like about what we do, because we can be honest with patients, explain to them these steps, and we're not trying to just sell them on the fact that they have to go on a CPAP, because we want to make sure they understand their options. Once they understand the options, the pros and cons, you make an educated decision. You have what we call a joint decision that the physician and you, or your provider and you, make. I think that allows a better partnership, rather than saying, yeah, CPAP, good luck, Godspeed, I'll see you in 3 months.
Sure. So, can we discuss CPAP a little more? Can you explain how that therapy works, and then if there's any side effects of using those?
So what is CPAP? I jokingly call it a fancy reverse vacuum cleaner. What it's doing is basically detecting whenever your airway narrows. So it's got an algorithm there, but it's also got a sensor that whenever the airway narrows and that increases resistance, it then pushes more pressure in. So this is related to the automatic CPAPs that have this special algorithm. And so whenever the airway is narrowing, it notices that there's more resistance, and then it keeps pushing up that air pressure until it doesn't detect any more resistance, and then it keeps it at that pressure. And if it over distends, it also knows to drop the pressure. And so that's what it basically is trying to do, is trying to keep your airway open so it allows your brain to completely decompress and sleep and not have to keep being awoken just to keep your airway open. So that's how, breaking it down, that's how a CPAP works.
So, if someone gets a CPAP machine, how long does it take till they notice better quality sleep?
Depending on some patients, it takes a few days. Some patients, it takes a few weeks. The goal is to make sure that they're actually using it well. And when I say well, I mean by using it every night, using it 6 to 7 hours a night throughout that time that they're asleep. So a lot of times patients take about 2 or 3 weeks of nightly use when they first get started to really get the hang of it, to get comfortable with it, and to start figuring out the mask fit and how they're going to sleep in bed and so on. The usual kind of acclimatization period, like I said, takes 2 or 3 weeks, but the only thing that gets them through it is nightly use. If you break it up and every few nights, whenever you feel like it, you're not going to really condense your learning, and then patients be a little slower in terms of getting the full effect of it. Some of them give up because they're like, oh man, it's been 2 3 weeks and I haven't felt anything, but they're barely using it for 4 hours. The mask doesn't fit right. No one has talked to them about the humidity level yet. No one's trying to adjust this or work them through it. So part of what we do as well is when patients come to us, we actually hire a dedicated sleep coach that will be that person that they can text or call and say, hey, I'm having an issue with this, can you work me through this, and so on, so that person is kind of their buddy in terms of trying to make sure that there's any troubleshooting issues that are worked out. But that helps them kind of get to that 2 or 3 weeks of nightly use, get the benefit of it, because I tell patients that that's the tipping point that occurs right when you use it just long enough at night that you feel better the next day. And then once that happens, everything starts clicking because you're like, man, this is great.
So, of the three devices you mentioned, which one is the most common?
CPAPs by far.
Okay. I'm assuming
CPAPs
because
by
it's
far.
been around the longest.
Yeah, by far.
Okay. So, what are some other lifestyle changes and home remedies people can try to do to help with sleep apnea?
So, with sleep apnea, weight loss is really the best thing to do if you can do it. Like I said, a lot of patients struggle with weight loss because of this issue with how sleep apnea affects them. But definitely, if you want to kind of hunker down, and what I would suggest is this, you have to have an honest discussion with yourself. The idea is, we talk about New Year's resolutions, weight loss, and I tell patients this, well, especially my patients with mild sleep apnea. And I want to clarify, when you have the categorization of mild, moderate, severe, it doesn't mean moderate and severe need treatment and mild doesn't. I think a lot of patients have come back to us after many years of seeing other doctors and so on, is that, well, they told me it was mild, I could lose some weight. But mild and how it affects your health can be it doesn't correlate. The mild, moderate, severe helps us decide on the treatment modalities available. But for you having mild, you might actually have a large number of symptoms, while I have patients on the other side where they have severe sleep apnea and their symptoms are minimal. And the only reason they're there is because their spouses force them at gunpoint because they're loud snoring. So the mild, moderate, severe doesn't. But if you have on the mild side, yes, if you lose weight, you can. But be honest with yourself, set goals, set deadlines, because you don't want your life to be a recurring video reel or the same thing over and over again, and your sleep apnea worsening, you accruing all these other health issues because you never got the primary issue resolved. And so if you want to do weight loss, I would say set a target weight and a target date. Share it with someone that you care about, because once you make that open, you don't want to disappoint them, let alone disappoint yourself. So if you want to do weight loss as the first option on your own, set goals. And then at that point, if it doesn't improve or you don't lose a significant amount of weight, or your sleep hasn't improved, then seek help. Another thing you can do short term is obviously avoid alcohol. Like we talked about how that worsens it. speak to your your primary care doctor or your primary care provider and ask them about the medication that you're taking. Are they, some of them are heavy sedating medications? Could they worsen your sleep in certain ways as well? Because if you use it for pain, it might also worsen your sleep apnea. So are there things that you can slow down or stop doing? If you drink a lot of caffeine during the day because you're tired, and then that carries over to the night and not being able to fall asleep, then cut down your caffeine intake. Another one that works, and it tends to work really well, is elevating your head a bit. Now, when you elevate your head a bit, I don't mean just putting 3 or 4 pillows under your neck. I'm talking about, kind of elevating your torso, so your neck and your upper back as well. By the elevation, because of gravity, you don't actually collapse your airway as much. So some people snoring get better when they sleep a little bit more elevated. If you sleep on your sides and elevated, that's even better than just sleeping on your back and elevated. So those are short-term remedies that can help, because telling patients don't sleep on your back never works. I don't know when I'm sleeping on my back. Do you? Some people wake up and they feel the difficulty breathing, but I don't know what position I'm sleeping in. So I can't tell patients, hey, lay on your sides, because that hasn't really worked. There's all these home remedies about, putting a tennis ball in a little bit of a, wrapping it up in cloth and attaching it to the back here so that whenever you lay on your back, it's uncomfortable. So you lay on your side. It's never really panned out. There's been all these sort of gadgets to use as well that don't really work well. So I think if you're struggling with that and you think you might have sleep apnea, haven't been able to lose weight, or you feel like, man, I feel like my blood pressure isn't improving, I've got this AFib issue, or my depression's worsening, I feel low and I don't feel excited, I've got erectile dysfunction. These are all reasons to say, you know what, enough of me trying to do this at home. I need to seek care.
So I'm presuming smoking cigarettes would be a cause of sleep apnea as well?
Not really.
Oh.
Not really. It does cause some inflammation in your airways that might trigger some narrowing, but usually that affects your sleep in different ways, not necessarily affecting sleep apnea per se.
Sure. Interesting. My last question is: can mouth taping?
But don't smoke.
I don't smoke, so
that's my PSA.
We do have a couple studio camera guys that smoke. We've been harassing them for years, but hasn't worked yet. Anyway, my last question is: can mouth taping help with sleep apnea?
So yes, it can, and for patients with snoring or very mild sleep apnea, the idea of taping your mouth, actually, it's not so much that you force air through your nose. It's more that you keep your jaw forward.
Oh.
Because when you tape your mouth, you can't slack your jaw back and fall asleep. It keeps your jaw forward, which keeps your airway as open as possible. Now, how long does that last for in terms of treatment? I don't know, maybe if you have mild sleep apnea, or you snore a little bit and so on, it's a vibration of your tongue that's causing at the back of that, the narrowing, it might help. But I think it's pretty much a short-term fix. It's literally a Band-Aid on a problem that you're not dealing with. And it might be a short-term fix. You might want to use it only when you drink alcohol. If you drink alcohol once or twice a week and that's the only time you snore, maybe. But it's not a long-term fix. It's already a clue that it's something wrong, and it will progress. So if you do find that helps you short-term, great, good for you. And it's usually due to the fact that your mouth is taped and shut and your jaw's forward.
So I'm guessing if that worked, then the long-term solution could possibly be the mouth fixture you're talking about earlier.
Yeah, and again, it depends on the patient as well. Some people don't like the idea of anything in their mouth. People that have a major dental work and false teeth and so on can't use the oral device. But yeah, so a lot. The other thing that I didn't mention is also talking about the oral device is grinding. Teeth grinding is frequently triggered by sleep apnea. So if you grind your teeth, it's likely due to that. And don't just get a mouth guard that just sits there, because you'll find that you chew through it. Because what's triggering the grinding is the apnea episode. So whenever you're, I know I'm going off in tangent here, but I just want to make sure that everyone listens to this. When your airway narrows, and I said your brain is awoken to kind of restore muscle tone, it just doesn't have a simple one finger wand that goes, open up this muscle. It activates all your upper airway muscles, which include your jaw muscles as well. So it contracts forward. So when you're slacking off, your jaw slacking off and your airway narrows, and you have an apnea event, then you move your jaw forward and outwards, which causes the opening of the airway. So a lot of people's grinding is due to sleep apnea. And The mouth guard you can use CPAP to treat that. You can use the mouth guard as well to treat that. The main thing is to treat the sleep apnea, which is driving the apnea, driving the grinding.
Sure. So do you want to mention again your website where people can find you at?
Sure, yeah. Our website is so S for Sam, L for Larry, triple I, indigo, P with Peter, .com. So sleep.com, it's pronounced sleep. That was the cheapest way for me to get the word sleep. And we are in about 10 states right now: New York, Connecticut, Illinois, Kentucky, South Carolina, Virginia, Georgia, Florida, Alabama, and Texas.
How many different doctors are on your team? I see 2 on your site.
Yeah, 2, and we're hiring a 3rd, and we'll probably have a 4th soon as well. So we're because we're pretty booked up right now. So that's why, a lot of times our expansion as well is dependent on getting the right people in. We're very focused to make sure that we bring in the right person, because you want all the doctors to kind of feel like they have an environment where they can thrive in, do what's right by the patient, and enjoy the work. And so, there's a lot of these sort of overnight tech companies saying, "Oh, we're in 50 states." But there's no culture of care in them, and it's a big machinery. We're trying to make sure that we actually try to build a virtual practice that gives a shit. Excuse my language. And since this is something I founded, I get to choose and make sure that my patients actually come out of this feeling good, and I get to sleep at night.
Sure. Well, thank you for joining us today. I hope we can do another one. We'll pick another sleeping subject next time.
Definitely, and hopefully your listeners enjoy this and happy to come on again.